Well, once I heard in the song, follow the money, baby. So if you follow the money, if your doctor has accepted, say, millions of dollars for speaking for just a year or two from the same company, then potentially they could be compromised. That is a lot of money.
And I think a great one to start with would be, what are telltale signs that your doctor or nurse practitioner is compromised by big pharma? And then on the contrary, what are some signs that your provider is trustworthy?
Yeah. Well, once I heard in the song, follow the money, baby. So if you follow the money, if your doctor has accepted, say, millions of dollars for speaking for just a year or two from the same company, then potentially they could be compromised. That is a lot of money.
Yeah, that sounds like something that happened in the early 2000s with a company called GSK.
Mm-hmm. The golden era of drug reps and being a doctor, I guess.
Yeah, so if I would have gotten into this, let's say 20 to 25 years sooner, then I too may have been able to enjoy racetrack days, fishing trips, expensive stays at resorts.
Mm-hmm.
But despite what the public opinion or perception is, that really is not happening in this day and age. They've really cracked down on that kind of stuff. I think about the extent of what people can get are now like research funding, reasonable speaking fees, and then, of course, lunches and education from the drug reps.
Yeah, it's really kind of swung back the other way at a high level when you're looking at the individual healthcare provider. So the individual doctor, the individual NP, your GP that you go in and see in general, they receive essentially no significant funds or gifts. I don't think they're even allowed to do pins anymore. So if they have 2 lunches a year from a company, that's probably worth $10 or $12 total in the Midwest, or $40 total in New York or California. So it's essentially nothing, and it's not worth anything to them. And I can tell you from the many different clinics I've worked at and the many different clinics that colleagues have worked at, being a drug rep or an MSL is hard because nobody wants to listen to you because they all resent you for essentially taking away the ability to compensate them for their time to listen to something that is likely not going to change their practice anyway. A lot of doctors don't like using new medications because we are also skeptical of everything, or should be skeptical of everything. So it's on the drug company to help teach that. So just like there's the golden era of bodybuilding, kind of a little bit of a black mark on that is steroid use. Actually, a lot of a black mark on that is rampant steroid abuse on the golden era of bodybuilding, whereas in the golden era of big pharma, the 90s and early 2000s, kind of like extravagant expense on doctors is a black mark on that. But I would argue an even bigger black mark on big pharma right now is just the huge amount of money that's spent on ads.
Yeah, and that was something one of our audience members actually mentioned was the advertising. And then I guess one thing that I've seen an interesting pattern with some of these larger health systems is that they don't want the perception that there's any influence from big pharma. So they actually ban reps from coming in and talking about medications or even lunches or even giving samples. And there's certainly pros and cons to that. So, the pro being the public perception, and then your risk of, bias or a prescriber's opinion being swayed one way or the other is very low. But at the same time, then you may have expensive medications where patients could benefit from samples for improving their condition, quality of life, and you're essentially taking that away. So there's pros and cons to that. And I don't know that that makes large health systems a hero. Someone asked us about whether they were evil or hospitals were evil or big pharma was evil or whether it was the insurance companies. And we'll get into all those details.
We will.
So this is going to be a fun podcast.
Absolutely.